In the early days of the pandemic, the state's Medicaid insurance program, MassHealth, put a pause on its reviews to determine if its members still qualify. But now, for the first time in 3 years, that annual review is underway, and the program expects around 300,000 people will lose their coverage. MassHealth covers around 2 million disabled and low-income adults and children in the state, though officials have said they believe the review will largely affect able-bodied adults whose financial circumstances changed since the height of the pandemic. And joining me to discuss what this will look like and what patients can expect are the Assistant Secretary for MassHealth, Michael Levine, President and CEO of the Massachusetts League of Community Health Centers, Michael Curry, and Jennifer Smith, a staff reporter at Commonwealth Magazine, who's been covering the eligibility review. Jennifer, I just want to start with you, and welcome to all of you. What's the story here? What's happening?
So as you mentioned, Sue, what we're seeing is something that has been kind of on pause for 3 years. People are going to start receiving notifications that they're being either reconsidered for eligibility for MassHealth and the government needs a bit more information from them, or they're in good shape and they can expect that their coverage will automatically be renewed. And the reason that this might seem like it's kind of coming out of nowhere for people is because, as you mentioned, there was a pause because we got federal funding from the government, and part of that came with the requirement that we just automatically re-enroll the people who are in most need of this coverage.
And Michael Levine, it's important to note that, again, this would be an annual review that would have happened anyway, but because of COVID, it was paused. And you're not going to do this. It didn't just all happen on April 1st, right?
No, this is absolutely a marathon and not a sprint. So the federal government has been clear, and we've been clear that we're going to take the next 12 months to work through our full 2.3 million member caseload, sending out renewal forms every month to about 1/12 of our members to give everyone the opportunity and the chance to work through the eligibility process, confirm that they are eligible for MassHealth, or find affordable coverage on the connector if they on the health connector if they are not eligible for MassHealth.
How much of a heavy lift, Michael Levine, is this for your department? Having now to do sort of a backlog. I imagine lots of folks. I'm dealing with a young adult in my household who I'm reminding you have to open the mail when it comes in, and you have to check your voicemail when they call. I imagine that there's a lot of challenge here and work that your office has to do here to get the message out.
This is our number one priority this year. The North Star for us is preserving universal coverage in Massachusetts. And the only way you do that is making sure that everyone who's eligible for MassHealth stays enrolled, and everyone who's not eligible for MassHealth, again, finds affordable insurance on the health connector or with an employer. The good news is, we've done this before. Normal course of business prior to COVID was that we renewed you every year. I think what makes it hard, what makes this a heavy lift is really two things. One, our caseload is much higher than it was prior to COVID. We've grown from 1.8 million members to 2.3 million members, and that means more people that we have to renew. And also, we're all collectively a little out of practice. We've continued to send our members, requests to confirm their eligibility over the last couple of years, but it's going to really start mattering this year. So we need to make sure that members are aware. And one of the ways in which we're doing that is we're not just relying on the mail. We're going to be texting, we're going to be emailing. We have community partners who are knocking on doors. There's a lot of work underway to really get the word out to ensure that people know they need to take action.
Michael Curry, the other concern here, obviously, is that areas of our community who may be most impacted are Black and brown members of our community. Also, that terrible quandary of you made just a little bit more money than you did before, and now you are disqualified. And as Michael Levine says, hopefully you'll be able to find coverage, but that terrible you've gotten forward, now we're going to move you back a second trap that our system seemed to do. What are your concerns and how are you addressing them?
Yeah, so one, credit to Mike Levine, who, as we started this conversation weeks ago, said, hey, Michael, I need to come by the office and meet with you and figure out how we can do this together and do it in a responsible way. We also have had that conversation with the newly appointed Secretary of Health and Human Services, Kate Walsh, and the governor as well. So, we're fortunate to be in Massachusetts because we get it. And we do still face challenges, but we try to do that together in a way that much of the rest of the country does not do. That being said, vulnerable people face the same circumstances. If the state is out of practice, then know that we're out of practice in getting the mail and checking the mail and going through the process of being redetermined, which means that I may lose coverage. And Mike knows this term we use in health policy. We call it churn. People are on coverage, then they're not covered, they get a job, they don't have a job, and they're bouncing between different types of coverages or no coverage. So our job is to make sure that we're there wherever they are, and we can help them navigate the systems, answer the questions, get the right coverage from the connector, whether it's Medicaid, whatever that is. We have to be ready and willing and able to provide them with the resources they need.
Jennifer, this is a tough story to cover because as a reporter, as a journalist, you have to explain what the problem is, and then you have to explain what people should do, and then it's generally in an area where folks don't want to pay attention to it. And obviously, to the points of our other guests, there are also caretakers who are trying to help people who may be disabled or need extra help or need some assistance with language barriers and other cultural barriers. How did you approach covering the story? Because you did a great job making it very clear, which is why I invited you here to do the work for me.
Perfect. I'll try it all over again. I think, especially in a case like this, the balance that's so delicate can be trying to make sure that people understand the scale of the problem and what they can reasonably expect, while at the same time not causing undue panic. It's really easy to get tied up in sort of the big headline of hundreds of thousands of people are probably going to get news that is new to them at least and not welcome perhaps as well. And so when I was looking at this story, I tried to make sure that I was accounting for regional differences inside Massachusetts too. I was talking to folks who are interested in making sure that not just communities of color and not just kind of disabled or other minority populations were being informed, but also ones where the difficulty is, to Mike Levine's point, that you're going to need to get people out on doors, that people are going to need to physically tell people out in other parts of the state, look at your mail, answer your phone. So when I was thinking about how to try and explain this as neatly as possible, it was really trying to break it down, keep it simple, and also try not to panic people. Just say be on the lookout.
So, Michael Levine, if you're on, and you did a good job, very good job, by the way, Jennifer, again. Michael Levine, if you're on Mass Health, if you're on the connector, what should you be doing right now? Should you be being proactive, or should you wait, or should you just make sure you are checking your text messages and your information is updated as well, your phone numbers and your contact info?
Absolutely. So if you've moved, you should call us and let us know, because we want to make sure that if you need to respond to a blue envelope, when we send you one in the mail to provide us updated information, we want to make sure we send it to the right address. Otherwise, aside from updating your contact information, I think the most important thing is to keep an eye out for the mail, for texts, for emails, to make sure that when you do get a request from us to give us a little bit more information, you know that you have about 45 days to respond. And it's not just it's not just Mass Health or the connector that someone's going to be hearing from. They're probably going to be hearing from their primary care physician at a community health center. They're probably going to be hearing from their health plan. They're going to be hearing from lots of community partners to keep an eye out for a blue envelope and respond when they receive it.
Michael Curry, I'm already feeling the pain of the staff at the health centers. I know how much stress and burnout and churn, to your word, has been at all medical facilities across the country, especially primary care physicians and the burnout there, as well as support staff, and now this additional layer of things that have to be done. Wouldn't it be great if we could just leave all these people on Mass Health at the status that they are? I know you're a data-driven guy, but we don't have stats on how this coverage improve the outcomes of the people who were covered due to the 3-year pause. But I imagine you have some feelings about that, how things would just be better if we could leave it the way it was.
Yeah, I mean, some of this isn't rocket science. We know that people have better outcomes if they have a relationship. They have the coverage, then they have a relationship with a primary care provider. It keeps them out of the emergency room. It keeps them out of inpatient days. It treats their disease. It keeps them healthy with preventive care. And as we went up from 1.8 to 2.3, that meant that more people had access and they had reliable coverage. It is concerning. Health centers are on the front line, as Mike Levine knows. What I worry about and keeps me up at night is, one, they're dealing with the workforce shortage that everyone's dealing with. And you could have every health center in the state is dealing with losing a provider. That means it could take you a year and a half to recruit a new one. That means an access issue. On top of that, they're dealing with deferred care. Many, many people have not come in to get their teeth, their eyes, their substance use disorder, their overall physical health cared for. Redetermination is another aspect of this, I'll call it a tsunami, of a lot of different concerns, and we got to mitigate the impact of it. And I think Mike and his team, as well as the governor and secretary, are doing a tremendous job. And the federal government is investing in community health workers, people being patient navigators, people being engaged with patients. Come on in. Can we help you? Can we guide you? That's what we should be doing, and I hope it'll have the maximum impact.
Michael Levine, I know that we're not over COVID. I don't want to all give the false information that the pandemic is over, but we are in a spot at least now where it seems that we're stabilized and we know what's what. But I'm wondering if the healthcare industry at large is taking this opportunity to examine what was done correctly and what was not done correctly. And I don't mean in terms of vaccines and serving, I mean in delivering the health care and the staffing issues. And if that is helping to give some tentpoles or some foundation maybe to the idea that if we had better access to affordable, if not free, health care, we might have had better outcomes. Is that discussion happening now?
You know, I do have to say that we are incredibly fortunate to be in Massachusetts. In large part for a lot of reasons, but MassHealth and the Health Connector together are an integrated system that will allow people to find affordable coverage, whether they're eligible for MassHealth, they're eligible for the connector. And it's really a seamless experience for members transitioning from one coverage type to another that will enable them to maintain their access to a primary care doc at a health center, or it will enable them to, keep on whatever pharmacy regimen they are on. And that's something that a lot of other states don't have. To your question about what has this access meant and did we get it right? Here at MassHealth, we are really focused on creating an integrated primary care based model for all of our members through accountable care organizations and through a primary care model that our health centers, our hospitals, and our physician groups are all building together over the next few years. And I think even as we go back to, what I'll call business as usual, where you got to check your eligibility every year to maintain MassHealth, I think it's really critical that whether you got Medicaid, you're on the connector, you're on a commercial plan, you're on Medicare, you have a primary care home that can give you the support that you need. And you live in a state where you're not going to experience the kind of coverage gaps that you're going to see elsewhere in the country, where where Medicaid, the Health Connector, and employers aren't working so closely together.
Jennifer, what's the next steps for you at Commonwealth Magazine in covering this story? I mean, what happens? Do you follow it all the way along, or?
I mean, the real joy for me is from the hearing that I was covering, there were a few things that Mike Levine pointed out that are actually going to make it easier, not just for journalists to follow this, but also people in general to follow this, and community health centers and health advocates, which is a bit more information on the data, seeing where people are losing coverage, why they're losing coverage, who, anonymized of course, is losing coverage, to kind of get a handle on the demographics that we're looking at, especially given the areas of concern. I think the other thing to keep in mind that's really struck me throughout this process that I'm going to be keeping an eye on is the emphasis on smooth handoffs. There was a lot of alarm, if we could call it that, a concern from lawmakers during the hearing, basically saying, we know that when something breaks down, it's not just community health centers that get the call, we get the call. Our offices might just be flooded with concerned people, and they referred back to what ended up being the situation with unemployment during COVID.
Right.
So that's still a bad memory in the minds of not just a lot of residents, but also a lot of lawmakers. So I'm looking to see going forward how well MassHealth and the state in general coordinates between different points of contact that people might be running into.
Michael Curry, I'll give you the last words. Any word to folks watching and to your colleagues across the state?
One is I feel confident that we figured it out in COVID. If we can carry those lessons forward, you need community engaged. You need to make sure the community is at the table, and equity centers all this work. We need to drive resources where the most vulnerability is. And in this 300,000 population of folks that are vulnerable, let's make sure that we get them the coverage and they don't fall into the cracks.
All right, Michael Levine, Michael Curry, Jennifer Smith, thank you so much for all of your insight on this. I wish you good luck. Keep us posted. Thank you.